Is Tuesday, June 17th. It is 3 p.m. We're in the Tom Baker Room, so I'll call to order the Burley County Human Service Zone Board meeting, and we'll start by doing roll call of the members.
Galen Becker.
Here.
Kelly Berglund.
Here.
Senator Dever.
Here.
Tracy Famous.
Here.
Jim Holm.
Here.
Trevor Vanette.
Here.
Director Flory.
Here.
And Commissioner Bakken, for the record, is absent.
All right, thank you. Next on the agenda is the approval of the meeting minutes from our March 18th meeting. So those are in your packet to review. I think you were also sent those ahead of time, but if anybody had any comments, questions, concerns, any corrections they wanted to note, otherwise I'm open for a motion on the minutes.
I can make that motion.
Perfect. I got a motion. If anybody wanted to second that. Thank you. Okay, so we have approval of the March 18th minutes. So all in favor say aye.
Aye.
Any opposed, same sign. Motion carries. So next on the agenda is the review of my annual evaluation. So this would be my June 24th through June 2024 to June 2025 eval. This is completed in collaboration with the zone board. So Tracy receives this as my vice chair to add comments on behalf of the board. And then as well as HHS provides their input. So that's also in your packet. You can see if you wanted to go over that. Basically, part of the evaluation, I'll just kind of go over it a little bit, is I am required to pick a value for the year that I want to focus on. Not that they're not all important, but it's integrity, collaboration, stewardship, transformational leadership, or advocacy. So this year I picked advocacy as my goal that I want to work on. And so in summary, I won't read it to you all verbatim on the record, but basically I want to focus on this in regards to my child welfare team members who are in the process of a case management redesign. And during that, I participate in work streams for this redesign, and I can support my team through that. So that is time that I give to the statewide redesign effort. I also advocate for the workload and case management, ensuring that team members are set up for success regarding the standards of administration that we'll go over again later. And then this can include with partnering different zones or state partners to collaborate to address our caseload needs. Regarding my team members and economic assistance, I sit on many work groups where we address process and procedures. We share ideas and recommendations straight from the workforce. I take that very serious when we're meeting with my management team from my economic assistance and making sure their perspective is shared, because sometimes the decisions are made by people who aren't actually directly impacted by the work. And then in 2024, I was able to initiate outreach for DOCR facilities. That was a great opportunity for my team members to stay connected to the Y while serving a population through reentry. So, and then I just continue to participate in many local groups, systems of care, human relations committee, community collaborations, advisory groups, ICWA partnerships, anything that I can. I'm also on the board of social work. So just things I do, those groups I have more access to, those that I serve, their lived experience that then I can bring back to provide better service delivery. Goal setting I had to set for the year. I probably set more than I should have, but I continue to, one of my goals is to improve the management team's knowledge and progressive discipline, receiving feedback from my local HR that it's been done well and consistently in certain areas. So just continuing to build that competency to my management team, so it's not heavy on me, but then as well as the others who are, again, more connected to the direct work. The goal of actively billing for targeted case management. So this was a slow start as we just started getting established as providers, but I'm very hopeful that we can be, I did say begin billing in July 2025, but I don't know if I'll make that goal. But more goals is just continuing our initiation of cultural training events for the community. I'm responsible for doing that. We did one in 2024 in December, and then I just had some other things come up that that wasn't something I was able to prioritize, but I am working on getting those regular occurring so that we can do what we call keeping the culture alive. So there are events for the kids that we serve through our case management world. Initially, I mean, I'd like to open it up to others, but that we can provide education on certain cultural aspects for Native American youth, which is our highest population we serve. I continue to work on just the prevention. I just write in here that in 2024 or into early 2025, our number of foster care youth increased drastically, despite our efforts on prevention. So we just continue to. I've gotten a lot of praise in our knowledge for safety determination. We're one of the highest zones to use prevention programs like shelter care. We'll get into those more specifically, but just continuing to work on that. And serving families in home and decrease our number of custodial youth. And then finally, my goal is just to continue our partnership with our foster parents, encouraging. We did start doing like a quarterly newsletter that'll go out to foster parents so they have more idea of our caseload and capacity, as well as doing like a spotlight of a worker each quarter so they can get to know our team a little bit better. So. And then I go over career development and training, just different things I've done. Again, at conferences I've attended or my work. I don't probably go into here much, but the work I do on the Board of Social Work is pretty heavy as well. And then HHS does provide comment on the evaluation. So again, just a summary of what they said. I won't read it all to you, but just acknowledging the work that I've done on targeted case management, trying to get the work I've been able to do for my economic assistance team and outreach with the OCR. They note the goal of mine of improving relationship with foster parents and things that I have been able to do and what they encourage me to continue to do, as well as acknowledging the need for managing performance. They noted that I have created a culture of accountability in my agency and need my support of my supervisors in order to continue to do so. My leadership, integrity, and first-hand child welfare knowledge has been greatly appreciated to not only my team but my peers, and I don't shy away from tasks needed to tackle and develop solid community relationships. So, and then if Tracy wants to go over in general the comments that she made on behalf of the board.
So, Director Flory, we have really appreciated your leadership with the zone, and so I'll share the comments that I wrote in reflection, but then I would open it up to any other board members and comments that they might want to share with you. So, Chelsea has demonstrated a strong commitment to the Burleigh County Human Service Zone, the youth and families within our community, as well as critical stakeholder groups. Her advocacy for her staff is evident in her passion for supporting them in a variety of ways, including timely hiring of full-time equivalency positions, providing training, supporting their needs through the supervisor workstream process, and her boots-on-the-ground approach to the work. Chelsea is not only willing but eager to step into any position when her staff requires support in meeting the critical needs of youth and families. Chelsea is an exemplar in reaching out to others across the state for insight, communication, and brainstorming. She is a strong leader, but also sets the example of accepting guidance and support from others. She is an innovative and forward thinker, which is evidenced by her creativity in working with the DOCR facilities. This is just one example of her proactive approach to serving those within the community. The advisory board supports Chelsea's goal to move forward with training for the billing process for targeted case management. She was able to successfully work through barriers which were beyond her control to make this happen. This is a strength of Chelsea's. When barriers arise, which are out of her control, she remains positive and collaboratively works through issues. The board applauds her work with initiating the cultural training events and her commitment to supporting not only youth in foster care, but also the foster care community. The board is also very appreciative of her efforts to clearly communicate with board members, keeping the board informed. We're fortunate to have you.
Thank you.
Mm-hmm.
If anybody else.
Anybody?
Yeah.
Any comments?
Else, or?
I just have one comment, I guess. You know, we get asked to comment on this, but I think a lot of what Chelsea has done a lot of good work. But a lot of it's driven by the Department of Human Services. And it's just, I think Chelsea gets good feedback, but I just think a lot of it is department, you know. The department puts it on and we just provide the feedback. She does great work, you know. I think she's doing the job she needs to do.
Thank you.
The only other thing I guess I'd like to add and kind of expound on would be the communication piece that's mentioned in here. Obviously, I appreciate the communication that we have at this level, but also in the position I hold with the Sheriff's Department, anytime I am in a need to reach out to Chelsea, it's just the communication is great, transparency, and it's just truly appreciated. So, thank you.
Thank you.
I'd like to add one thing too.
Yeah.
Everything I hear about you is really top notch. And what I see too, so keep up the good effort.
Thank you. Yeah, no, overall, I appreciate this board. I appreciate the opportunity to serve Burley County Human Service Zone and the citizens, the children, the families. That's definitely my why, my passion. I get told a lot that I'm too hands-on. I need to not be hands-on, or I need to let my team do things, but that is my leadership. That's what keeps me motivated. Those are the things that keep me coming back the next day. So often when I'm not having good days and there's kids in the building, you will find me seeking out those children because I just need a break and doing that. So yeah, I appreciate you guys and your support, and I don't plan on going anywhere. So. Okay, then I do require a motion and a second to approve my evaluation, so we'll entertain a motion on that.
So moved.
Thank you. Thank you. I have a motion and a second, so all in favor, say aye. Any opposed, same sign. Perfect. Thank you, guys. The next one would be the review of the Burley County Human Service Zone Policy Addendum. So those are also in your packet. I did send those out ahead of time for everybody to review, because it is, this is our addendums to our policy. So for the human service zones, we have an HR manual that is for all human service zones, and then zones specifically could have addendums just to meet the needs of those local zones. So that's what you see here in front of you. So I don't know if anybody had any questions when they had the opportunity to review them. Really, any of the changes that were made were just to align with any HHS guidance or things to make things more consistent across all zones. So there isn't really anything that was too impactful.
I would also just add to that this is kind of our opportunity to marry Burley County's policy expectations as far as what local expectations are to our zone policy. So this, a lot of times when like the Burley County HR department will have some policy, some language change to a policy, we'll implement that as well if it's a policy that we can address in here. So leave without pay, or not leave without pay, but yeah, family medical leave, leave without pay, leave sharing. That plan was updated fairly recently by the HR department, so we made those language changes to match. So that would be the only other thing I'd add to that.
So there's not any comments or recommendations, or if there is, open for discussion on that. Otherwise, again, I'd entertain a motion regarding these policies.
I have a question on the annual leave usage.
Yeah.
If a person doesn't use it all, instead of losing it, can they give it to someone who needs extra sick leave?
There's a leave sharing policy, but there's certain requirements for that.
That's separate, it isn't listed here, but it's listed somewhere else in the document?
Yes.
Okay, thank you.
Mm-hmm.
Did you have anything, Trevor?
No.
Nope, okay. Sorry, I was just gonna go on, then I didn't know if you were gonna say something. Yeah, so if anybody, if you don't have any questions, I just need a motion and a second to approve these.
I so move.
Thank you. We have a motion and a second, so I'll just say all in favor, say aye.
Aye.
All right, any opposed, same sign. All right, motion carries on that. Thank you, guys. Now we'll just get into really the agency reports and the updates. I'll kind of go over the economic assistance ones today. I don't have too much to update on. And again, a lot of the work we do is statewide, driven from local agencies providing the service delivery, but we operate on this as a statewide team for most of our groups. So as of June 1st, our LIHEAP, that's our heating assistance program, went to a year-round program with the first wave of reviews coming due in October, and then the remaining reviews will be aligned with the other program over the next 18 months if the family's enrolled in another program, to just help not have all the reviews happen at one time. This will help with paying electrical utilities. The help with paying electrical utilities is currently on hold while they look at block grant funding and sorting out kind of where the funding was coming from, because there was grant funding that impacted this program. The next area would be the TANF modernization, which is soon to roll out. Date is not yet determined, but recently the supervisors and leads, along with workers from economic assistance, community option, and housing, state policy staff, attended a training they called Goal for It. The point of that training was really to roll out what TANF modernization is going to look like. The next training session is held in August for all workers that process and participate in the TANF program. Our most recent, we just had an all-staff meeting on May 27th. So this was for my economic assistance team. We had Ministry on the Margins come in, and they did a presentation on the programs that they offer. Again, it's just my attempt to try to bring that team. A lot of them work remote, so it's an opportunity for them to come in person and get some continued education, as well as learn about their community. So when they're serving clients who live here, they might have an extra resource. We're going to continue to look for other community partners to come in and share at future meetings. It was well received by that group of employees. They enjoyed that time. We also have had EAP come in and talk about stress management and burnout, but I think the response was maybe we'll take a break from that at the next meeting and just try to focus on community partners coming in. So otherwise, it's just kind of continuing to look at the statewide model, things that can be improved. You know, we're over 2 years into the redesign process now, so it's just a good point where we're evaluating what we didn't redesign, what worked, what didn't work, and what we want to do different. So yeah, I don't know if anybody has any questions on economic assistance.
I just like tell people I get complaints from consumers that I hear from lost papers occasionally, really struggling, EBT cards locked. It's hard with the zone. You know, when I email, Kelsey, she was able to help, but it's complicated for consumers that I serve. You know, it's hard for them to do this. It takes 2, 3, 4 hours if they gotta call EBT ed and all that. So I just want that on the record.
Oh, is his mic on? That's what she's asking. His mic is. No. Sorry, Trevor, we're deciding if your mic was on.
I think it is. It's good.
Okay, thank you. No.
Do you want to start over?
No, Trevor, I appreciate your comments. You're always definitely somebody I look for to give me feedback on specifically communication that's being delivered to those that we serve, whether that's coming in the form of a notice that may be complicated or cause panic, to those who are receiving the notice, to your experience with the call center and wait times and responses that you're getting. So I do pass all your concerns along. So, yeah.
Yeah, it's just frustrating complaints I hear. Here, you know, it's just constant. They have done the paperwork for last month, and they say they have to do it again. So it's very scary for these families, and it's hard. You know, I had one client that spent extra money out of their debit card because their EBT card was locked on a weekend. So we've really got to watch that, because that is affecting clients. And I would just appreciate, you know, the department and you working on that, because on a weekend they can't call. They don't know the EBT edge, you know. Mm-hmm. Nobody's there. it was just a random case of, oh, the card's locked, sorry, and then they had to unlock it. So I just really feel strongly that we got to work on that. Thank you.
To Trevor's points with the EBT cards, we as directors talk about how we wish they were locally delivered. We used to be able to issue those right in the office. We've talked about this at this meeting too, but now they're delivered from a third party out of state, a vendor. And so if somebody loses their card, they have to ask for another one, and it could take a week or two to get one issued to them. So it puts a hardship on families. And I've also heard from my community partners or stakeholders that run their food pantries that they're seeing an increase of people who are needing those temporary boxes because they're waiting for their cards to come. So that is still a conversation that we have as our association of directors, that we would like a hybrid option where you can still use that out-of-state vendor, but we still have the option to issue a card in person.
And I think part of that, though, too, is when their card is locked, we got to have a place to, I'm hearing that it takes 3-4 hours with EBT Edge to figure this stuff out. It's complicated. I'm on the DCIL board, and their workers try to help these clients. Each client, it takes 4 or 5 hours to figure stuff out. So we got to really work on this. It's getting to the point where people are not even wanting to apply for the program because it's just either their paperwork's lost or the EBT Edge isn't working. So we got to really push on that. I've had 2 cases where that's been a problem. And so I would just encourage the department to let you guys have a little say at the local level. I feel it's too much complication in the system.
That's good feedback. Thank you. Okay, that's all I had for that program. So we'll just move into our child welfare updates. So I did ask Kayla, she is a supervisor over our CPS unit, to come today. She put a presentation together. Off of our last board meeting, there was definitely an interest in wanting to, I don't know if everybody remembers, it was 3 months ago, but interest in just wanting to have more conversation regarding our process from our involvement with the family to the safety planning part. We won't get into like what case management looks like then. We can talk about doing that at a future meeting, but just to break it up, we're going to start with from the moment of reports received through intake to our safety determination and some of the prevention services that we do. And so I didn't plan too much more than this because I wanted to make sure you guys had time for hearing Kayla. And when I asked her to do a presentation, it's like, well, you want 15 minutes or an hour? So Kayla is well versed in all the aspects of child protection and the different assessments that we do. So feel free to ask her questions. And if we don't know the answer, we'll definitely get back to you. But I just wanted this board to have an opportunity to engage and have a deeper understanding of what we do in that way. So I will kick it off to you, Kayla. Make sure your mic's on too.
Hello, everybody. Okay, so there's no really formal, I guess, process to doing this. You can ask questions as I go. So prior to the zone receiving any reports, they go through our centralized intake unit. And so that is a unit that is around the whole entire state of North Dakota. They do have 19 members that make up that unit. There's a centralized line that's added on here for people to call. So usually if you have any contact with anybody at the zone, usually that's on even our email, like after our name as well, to be able to call in and make a report. Intake will call if people do file a 960, they'll call to do follow-up questions. There are several questions on our intake tool that need to be followed up on so that we make sure we have all the details and everything when we're going out to meet with a family. Then the intake unit will make the decision if the report actually meets the definition of child abuse and neglect. So if it doesn't meet that definition, I'll talk about this a little bit later, what the report is considered, but it is still stored in our system, so we still have record of it, but it just doesn't get pushed through to a full assessment and get assigned to a child protection worker. During that process, the intake worker will decide the categories. So our categories in child protection are A, B, and C. I'll go into the details of those as well a little bit later. And then we do get what's called a full kit. So Jim Holm knows when we send stuff over to the Sheriff's Department, typically we're sending it with, we call it a full kit, but it'll include the intake tool that intake will have filled out, and then a 960 if the person filing it filled that out. And then maybe it's a police report because law enforcement would have already responded with them, or maybe it's like medical documentation that we would have got with it. So we try to have everything kind of together so that that worker can have all the information at one time. And then we do provide referrals to tribal and law enforcement agencies, and those are called ARs, administratively referred. We'll talk about that a little bit later. And then those AAs, like I talked about, that's those reports that we do receive them, we keep them, they are in our system, but it's not something that gets pushed through to a child protection worker to go out to assess. This is just talking about everything that goes into a report. So if you are calling to file, these are the types of things that we're looking at. Of course, if you do not know some of these details or you have more details, that's perfectly okay. If you call in and you have very limited information, an example I use is like you're in the Shields parking lot and you make an observation of a family that you do not know, you're obviously not going to have that information other than probably their make and model of their car and what you observed, right? So we often do get reports that are, we say that they're just unknown reports, and then we try to investigate to find if we can see if it belongs to a family and if we can identify them to make contact. So on the bottom it kind of says, by law, the reporter information is confidential. Reports filed may be shared with juvenile court, law enforcement, tribal partners, or other authorized agents. So just so everybody does know, whether it falls in the Sheriff's Department jurisdiction, tribal jurisdiction, or Bismarck Police Department, it does get sent to a law enforcement entity every single time. It does not matter if it's a educational neglect report or if we have a very severe home conditions or bruising and injury to a child. We do send those to law enforcement mainly because then they can do some follow-up on their end, and they'll kind of let us know, give us some guidance if there's been any recent reports with that family or reason to be concerned, or if they should plan to go with us to make contact with that family. So here's the definitions of the AA and the AR reports. Administratively referred reports are going to be the ones that they fall outside North Dakota CPS jurisdiction. So that's going to be not in North Dakota. The reporter implicates the subject is not responsible for a child's welfare. So this is a non-caregiver. I'll tell you, this is probably the one that causes the most angst for, I guess child welfare staff, but also the general public. The definition of a caregiver under Century Code is not what you or I would typically expect. It's not going to be every person that's ever taking care of a child. So usually there are situations where law enforcement can charge somebody with a crime because they did commit it, but it might not be that that person is considered a caregiver under the definition of North Dakota Century Code. So that kind of becomes a little, once we determine that they are not a caregiver, we then cannot assess it. We can't have a finding, a CPS finding on somebody that can't even be considered a caregiver. And then if it happens on an Indian reservation in the state of North Dakota, that does have to be sent, that would be sent to that applicable tribe. And then CSB's child sexualized behavior. When the CSB cases do come in, we, at a minimum, will put a safety plan in place with the family, but these are situations, again, law enforcement is typically getting involved, and then we'll make a decision if we're doing a forensic interview with the child, and then law enforcement will make a decision if it's a chargeable offense for that child.
The only thing I'd add so far is like clarification, the non-caregiver, just some examples for you would be like a neighbor to a child, like something happened, a crime may have been committed, but they're not technically deemed the caregiver. They don't meet the definition of that. A cousin who's staying at the house, he doesn't provide any caregiving to that child. They're frustrating because we know that it happened, but they're technically not deemed a caregiver. And then the other thing is around the child's sexualized behavior. So those are really, sometimes we refer to them as kid on kid. So we look at, during those assessments, the age of culpability, like what happened. So sometimes it is 2 5-year-olds engaging in sexualized behavior, or, is it normal curiosity? We work with the families on education around that, supervision, or sometimes it's more egregious acts of things that happen where it might be, a 12-year-old and a 2-year-old, so there's just different things that happen that come into play in those cases that we have to consider. But the ultimate goal is getting both the victim and the child who engaged in the act. I don't want to refer to them as a perpetrator because really they're still children, but really the ultimate goal is to get them both services for the trauma and the behavior and try to correct those things. So that's kind of the approach we take with those. They're very family engaged. In the event we're working those cases and the family isn't engaging, or we have reason to believe they failed to take action, that's a whole nother report that it needs to be made to then assess the family's capacity. But they're really centered around the family.
And then the administrative assessments, those are the ones, like I say, we do have them stored in our system, but they don't meet criteria for child abuse and neglect. So just some examples of those or things of those. The child in question is over 18. There's no credible or causal reason to suspect abuse or neglect. And it was addressed in a previous assessment with no new incident of maltreatment. So sometimes it's frustrating calling in as a reporter because you're not going to be privy to a lot of the information that you're reporting. And it's just important as mandated reporters to know your job is to do the reporting. And then if there's further assistance needed, that Child Protection will reach out. Okay, our response times. So response time A is, I always refer to this is going to be our law enforcement requests, our on-calls, our middle-of-the-night calls. These are your serious physical injuries, sexual abuse, ingestion of illegal substances, domestic violence with an immediate risk to children, and no caregiver available. Those are just some examples of those. Hold on, I gotta go back to this one. I didn't make a B. Examples of category B reports are like exposure to domestic violence, psychological maltreatment, allegations of abuse where there is no injury, and usually the determination of whether a report is going to be an A or a B is determined on age and vulnerability. So there can be a lot of factors that change it from the category. And these are going to be our response times, right? This is law enforcement's calling us. They're on the side of the road with a family. Mom and dad are getting arrested, and there's no caregiver. We need to come right now to relieve them to take those kids and either find family or they have to come into foster care. So that's kind of the piece where that's going to be determining, I guess, what the request is as far as how promptly we respond. In A, you also can take up to 24 hours to respond to that. I'll tell you that's not typically how it is. Usually we get a category A and somebody's going out like, we're going out soon, like soon to address those. And then our category Bs are going to be 72 hours or 3 days response time that we have to make face-to-face and see those kiddos. When we talk about the category A, usually we have present danger that is happening within that family. That's what we're going out to assess. This is something that's immediate, significant, and clearly observable. These are things that are happening right now, and the family is unable to control them within the home. I always tell workers, if you are leaving this situation and you have the ick feeling and you don't feel like this family can keep everything safe and together, we need to have a plan. We need to have a safety plan. Either people are going in, people are going out. We have to come up with something, and if they can't come up with that plan, our next steps then are to talk about custody, whether it's appropriate for us to take custody of those kiddos. Some examples of of present danger that we have when we train staff are physical conditions of the home. Home conditions are hazardous. This is, you're thinking of dog feces, exposed wires. Kiddos are crawling around. They have access to chemicals. They have access to paraphernalia. They have stuff stacked up on the walls, and it could fall on top of them. Those are the types of home conditions that are going to be hazardous. Caregiver is unable to perform essential duties because they're under the influence. Those are going to be the situations where we or law enforcement determine that they are under the influence and they can't caregive for the children. Sexual abuse, child requiring immediate medical attention, and say that a parent is unwilling to address that. We will then give them options on making sure that gets addressed, whether they have to go to the walk-in or it's usually the emergency room. And then injuries to the face, head, serious bruising, burns, broken bones, and cuts. This is typically going to be a situation that doesn't really matter the age of the child. It's really determined on reports from collaterals, reports from that kiddo, and then obviously what we observe when we come in contact with them. So Chelsea referred to our shelter care program that we often use, so we wanted to incorporate this in here and just talk about it a little bit. The shelter care program is relatively new to North Dakota. This is a prevention service. I did put the policy on there so that people can look it up if they would like to later. But this is a temporary care situation, so where a child just needs a safe bed outside of the home. The length of time that this can be done is anywhere from 1 night to 14 nights. Typically, they want us to use it for 7 days. They want you to use it for a week, and then the licensing department asks that we put in an additional request for up to 14 days, and they'll let us know if it's approved or denied. We haven't gotten them denied when we reach out for them, so typically they're very good to work with us on working these prevention efforts. The provider does have to be a licensed foster parent in order to be a part of the shelter care program. It's the only thing that's really different for foster families is that, say that we place a kiddo in shelter care today and they have to go to the walk-in because they skinned their knee or they need to go in, we still need a parent's permission in order to medically treat because we do not have custody of that child. So we will have a conversation with the parents, and the parents have to agree to this program. They have to agree that this is something that they are willing to do. And so we will let them know there's going to be times we're going to need to call you and we might need to ask questions. So please be available for us. And then all families and children that we work with are eligible for this service. So that's the eligibility requirements. And then just some numbers as far as what we have done so far. Burleigh County has utilized this program in 76 cases. That we are the highest county in North Dakota for using the shelter care program. 32 of these cases have entered foster care. So what that means is we utilize the shelter care program for 7 or 14 days. And once we reached that 14th day, we were unable to reunify with the parents. And so the kiddo did end up coming into foster care. And then 44 of these remained in either like CPS just kept them or in-home case management services was open with them and working with the family. And the kiddos were able to return back home. And then I guess the average length of stay is 12.5 days for that program.
The only thing I'd add is that for a CPS worker, and you have, and even in-home workers too, they can utilize the shelter care program. But imagine you're a CPS worker, and we'll talk later about numbers and stuff when I go over that. But you have 20 open CPS assessments, and this you have an instant and present danger, and you're responding to the family, and you're offering them this prevention program for 7 to 14 days. That is when the work of that worker really kicks into gear. You have to be pretty aggressive about working with the family on whether it's remedying conditions with a home, getting mom to AARC to get her out of a bad environment that the kids are not able to be in either, contacting the tribe to let them know, hey, we're involved with this family. What do you know, or what sports can you offer? How can you help us engage with the family? That's really when we're doing a lot of that work, and it's got to happen fast and furious because your goal is in that 7 to 14 days you have stabilized this family, which is it's a heavy lift for a worker who has a high caseload, and the cases keep rolling in. So they could get another case the next week. That's another present danger in shelter care. So it's a lot for people to manage. It's a lot for my supervisors to keep tabs on. Like Kayla said, we're thankful for the licensing unit for the foster parents because they definitely keep us in line on homes that we're placing kids in and amendments to their license. And yeah, go ahead.
I just have a question. Now, is this something that the child can initiate? Or is that geared, and I'm not talking about an 8, 9, 10-year-old,
Yeah.
but maybe a teenager who's at battles with parents or.
So we do have a few things that we can do with that, right? There are situations where a child is, whether they're fearful of being home or there's just a lot of parent-child conflict. So in those situations, we sure can use the shelter care program. Again, parents have to agree to that. But we also can utilize YouthWorks. So the kiddos can, like, if a parent and child is having a conflict, a kiddo can go and stay there for a night or two for the weekend. I don't know the number of days that they typically have them stay, but it's kind of like a timeout, right, for a parent and a kiddo. And then usually if the YouthWorks program is utilized in the shelter, they will have a kind of discharge meeting, or they will have a conversation with them to come up with, when this happens, what can we do next time, right? Mm-hmm. It's much better for children to stay overnight at a friend's house, right? Stay overnight at an uncle's house, something like that, at a neighbor's house, then have to come into foster care or be with strangers, right? So just being really mindful and planful of those situations. But yes, there are times that we have come in contact with kiddos and they're like, I'm not going home, right? Or me and mom or dad are having a lot of conflict. And so we got to come up with a plan, and we're very much a part of that.
Mm-hmm. Thank you. Yeah. Thank you.
Other thing I was going to add is this program was kind of started because of our short stayers. Like, we did have, situations like Chelsea talked about where the ones that we always say are the housing issues, right? Like, say people are getting evicted, or say that people are homeless and they're going to get a place on the 14th, right? Or whatever. Those are the situations that this was kind of created for. And so this really has curbed a lot of foster care stays for kiddos. And it's really become a routine now, like, for us to utilize. So it's been a positive thing for us, I feel like.
Yeah, I think one case that really stands out is like those situations where we might be open and in home. We're working with the family. They're doing, mom is engaging really well, but mom has, maybe she needs to go in and deliver another baby. And so we're sitting there and she's like, I don't have anybody who can help me with my other 2 kids. What are we going to do? I don't have family supports. This is when we as zones were like, we're taking custody of children for something like that, right? And they're not able to be there. So this program is huge for just telling, we can use this shelter care program. They can go there for a couple days while this happens. We get mom settled back in and that kind of stuff. So that's just one example of something that doesn't really have to be abuse and neglect, right? Like, we think about, we're giving you examples of like a present danger and things like that, but there's times where it is not that, it's not on the parents, it's just the lack of resources and support they have. So this program has been fantastic. And when you pair this with the use of dollars that we have in the zone to support families with purchasing items for their home, maybe that they need to remedy, or securing the housing, whether we pay for an application for rent, for securing an apartment. I mean, there's just ways that we're just trying to get more creative in helping the family and stability, because in the long run, we want to prevent the entry into foster care. So this has been, I don't want to say fun, but it's been good to see like the work of my team get creative and think outside the box, and there's no wrong question to ask, because everything usually leads to the right answer. So it's been good.
Well, and it's nice because we can safety plan with a basketball coach, right? With a church leader, with a neighbor, with a, you talk to those teenagers, they're not going to stay anywhere that they don't want to stay, right? So you want to be creative. You want to be able to do that so that kiddos can be safe, and they'll stay where you have them go and not put them in a foster home and then they run, right? We don't want that. So
Yeah, I'd say kudos too to like Bismarck Public Schools. We've had a lot of luck where that family may identify the previous second grade teacher for that kid as a support or somebody in that school. And as long as they feel like it's all agreed upon with them, that's what we consider kin, right? That's comfortable for the child. So we've been able to do a lot of safety planning with, and I think later I'll talk about fictive kin placements and the percentage that we have placed with them. So that's been great.
yeah.
That's a good call out.
So the different child protection assessments that we complete, the first one I'll talk about is alternative response. So this is our substance exposed babies. We have one worker specifically that does these cases. We have seen quite a bit of success with that. I actually did that before I became a supervisor. So it's really kind of a specialty. You have to have a different kind of mentality, different kind of understanding of the situation. So these are the cases you're really working a plan of safe care with the parents. You're surrounding them with their safety supports, getting that all in place so that when we are not involved, that there are going to be people that step up to the plate for this baby and step up to the plate for mom and dad. Typically, the alternative response assessments are focused on mom, but there is a lot of stuff and referrals and services that will go into place for the dads too. So it's making contact with early intervention, with healthy families, with whatever hospital or provider they choose, and making sure everybody kind of stays connected in that way. We do work these for a minimum of 6 weeks. So under the policy, the worker only has to go every other week to make face-to-face contact, but we do make contact every single week is usually our requirement that we feel the most comfortable with because babies are vulnerable and we just want to make sure that everybody's doing okay. The middle column is our standard child protection assessment. So these are fact-finding assessments that enables a determination to be made, providing that we are looking out for the protection and treatment of an abused or neglected child. These are often referred to as a standard or a full assessment. And then at the end of these, we are determining, I know we talked about present danger, but we're determining if impending danger exists with these families. I will go into more detail about that a little bit later. But that's something that we are just anticipating. If we step away from this family and we do not provide case management in some capacity, it's likely that this behavior and this condition will not stay controlled without somebody's involvement. So we need to have a safety plan in place. We need to have those safety providers checking in with that family, whatever that looks like. Typically, this is the schools checking in with kiddos. They typically are already on a daily check-in. So we'll add that as part of the plan. So usually that's a really good support in that area. The last ones are family service assessments. So these are your old ed neglect reports. These can also include inadequate supervision or children in need of services. So this is an assessment that's deemed to be a low risk and there isn't any safety concerns noted in the report. If we get it as a family service assessment and something does come up that's safety related or we get additional concerns, typically then it can't be a family service assessment anymore and it'll get kicked to a standard child protection assessment.
Examples of the family service that I've done as a worker were ed neglect, where it was a grandmother raising, her teenage son, grandson. And when I was able to go in, we just talked about setting some boundaries, right? Like the Xbox got to go away before bed so that kiddo can get to bed and get up in the morning, setting some things to maybe be motivators for the kids. So you're really creating goals and a plan for the family. It's not due to their negligence that these things are happening. It's just because they just need some extra support. So it's a different approach. It's not, like Kayla said, it's more like an engagement. Other one is home conditions, but the two kids in the home are 13 and 16, they contribute to this home condition, right? We're going to work with the family on maybe we need to set up some chores, maybe we need to have some rewards and consequences, that kind of stuff to just help families and support them. So that's also been a good carve out of assessments to kind of separate them from those who truly, it's more of a neglect.
So when we staff our child protection assessments, after we gather all of our facts and everything, we do staff them with a field service specialist. So that is through the Department of Health and Human Services, an employee through there, and they are the ones that make the final decision, whether it's a confirmed, unconfirmed, assessment terminated in progress, unable to determine. Those are the typical findings that are listed on here too. The maltreatments that are listed there in the middle column. So prenatal exposure, medical neglect, environmental conditions, sexual abuse, physical abuse, psychological maltreatment are just a few. And then the last column just says are basically the definitions. Assessment terminated in progress essentially means that the worker went out to make contact with the family and the allegations in the report are not accurate, right? You go out and it's typically the opposite, or there isn't any factual basis around the information that's in the report. So it would be terminated. There isn't a reason to continue to do additional interviews. There isn't a maltreatment. It's still documented in our system, but we don't have to do a full assessment essentially on that. And then the other ones are unconfirmed, confirmed, confirmed with an unknown subject, and then an unable to determine. So even though we do an unconfirmed finding, it doesn't mean that there aren't concerns within the family. So that's where we're going to be looking at if there's impending danger that continues to exist and if we should stay involved with the family to help support them. So these are just some of our examples of the impending danger that I talked about. One, I'll just talk about a couple of them, I guess, that we use on a pretty frequent basis. I would say the number 7, parent or caregiver behavior is dangerously impulsive, or they cannot control their behavior. So that's going to typically be the one where we have concerns for drug use, concerns for alcohol use. Unfortunately, that's pretty prevalent in our community, and so it's almost rare now that we don't have that in some capacity in most of our assessments that we're dealing with. Another one that we typically deal with is number 13, lacking knowledge, skills, and or motivation necessary to meet a child's basic needs. Those are going to be those situations, right, where medical needs aren't being met, educational needs aren't being met, and so we need to kind of continue to be involved with them to help remedy that and have a safety plan surrounding that family. When we talk about impending danger, these are the criteria that we look at. So observable, vulnerable child, out of control, imminent, and severity of what's happening. So even though, like, say, a vulnerable child, they have in there that it's a 0 to 6, we have had situations where kiddos are 13, 15, 16. It really depends on even their cognitive abilities or, where they are at emotional maturity-wise, if we can use that as a reason for continuing our involvement. I won't read these all to you guys, but.
No, I just say the short and sweet is like you're observable. You have to be able to articulate it. Like, what are you seeing? What are you observing in the family? The vulnerable, like Kayla said, there's a whole array of what is vulnerable. And then out of control, there's nobody else who can control this. There's not another caregiver in the home, not a family member who's stepping in. Imminent, it's likely to continue in the next few days or weeks without intervention. And then severity, which what is the impact to the family if intervention doesn't take place or we don't have a plan. So our workers have to be able to articulate what this threshold, we call it, in order to explain why our involvement is necessary in the family, and then they also go through like a safety determination to where it helps them understand what level of intrusion they need. Like Kayla said earlier, is it in and out, like somebody out of the home, somebody in the home, grandma's going to move in to help monitor things, or maybe the concerning caregiver is going to move out, or people are going to come and do checks every day, or we kind of have to walk through with the family what's realistic for their lifestyle and the needs. But the goal is always to preserve the family unit while ensuring the safety at the right level of intrusion.
Yeah, we always try to just think that it's always going to be easier for the kiddos to stay in the home. So what can we do to make that a possibility or make that happen? And then just safety planning around, Chelsea kind of talked about this, but if impending dangers are found to exist within the family unit, worker must work to complete an in-home or the out-of-home safety plan. So this is our safety plan determination. When is the danger happening, right? If mom and dad are intoxicated only on the weekend, that's the only time that the danger is happening. That's what we're going to form our safety plan around, right? People don't need to be there from Monday to Thursday, right? Then if something changes, then we have to change that safety plan. But it's typically going to be around, we want to be the least invasive that we need to be with the family. We don't want to be so intrusive if it's not necessary, right? There's plenty of cases where it is necessary, but if it's not necessary, we want to be least intrusive always while keeping kids safe.
Yeah, I think when Safety Framework rolled out, one of the examples that they gave was a 2-parent household, and mom struggled with mental health and dad struggled with substance use, and then there was various kids in the home, like ages 1, 6, and 13. So the danger was different for each of those kids based on their vulnerability and their needs and those interactions with the caregivers. So for the 13, and this was like our case study when we rolled this out to train on it, was there could be parent-child conflict then between the 13-year-old and the parents because of those issues that the parents are having, and then all the way down to where the 1-year-old is a different level because they need more supervision, right? They need more care and control from that caregiver. So your safety plan will can have different layers to it, where somebody might be coming in to be more hands-on with the younger one and helping mom and dad with that, where the 13-year-old may be leaving the home a few times a week to take a break from that parent-child conflict. So it really takes a family-centered engagement to determine what that safety plan needs, who can participate in that. We're always asking the family, like, who do you have, who are your supports, and how can we build that? Because our interventions with family, we want them to be short-lived. We want to build the independence and the ability for them to live independently from us having to be involved. So it's just kind of helping them understand that, getting connected to services, other case management like the Human Service Center, so it doesn't have to be us ongoing. So yeah.
Any questions, comments?
Well, thank you, Kayla. So yeah, like just going over this presentation, this is really then how we get to case management, and then that's a whole nother conversation on the policy and procedure around case management. So our goal is always to keep cases moving through impending danger within home, which is then a category of cases where we're providing that to families, connecting them to services for the children, the parents. That can be substance abuse, mental health, and then working to get the stability so we can eventually phase out. They have requirements on those cases to see those kiddos 2 times a month in person. So that's in their safety supports home. So whether that's their home or they're going to stay with a relative or kin. And then the other level of intrusion would be when things elevate to the point where we need to have custody of the children, which is all done through our court system. So those aren't decisions that we just make at the zone. We have to staff those with juvenile court, and we have hearings and all those things. So, okay, well, thank you for that part. And so then I'll just kind of go into other child welfare information. So for Kayla's team in Child Protection Services, they received in the month of May, there was 224 reports of abuse and neglect received. How she talked about some of those don't meet the level of abuse and neglect. So of those reports, 171 resulted in CPS assessments. So the other ones of those were able to get screened out. Either they were, as she went over, they were A8 or AR, depending on the criteria. So currently our total open CPS assessments is 348. And I believe on Kayla's team you have 12 workers who those assessments are divided amongst. Yes. And then in the month of May, they were able to close 88 assessments. So this I can kind of jump into, sorry if I jump around on you, but I also have in front of you, we've talked previously about measurements. So on April 28th, you'll kind of have like a packet with a letter from HHS. This was, it's now being provided to our board. So I kind of talked about this at our last board meeting, so you guys had an idea what these measurements were, these standards, so we could start talking about them going forward. So you received, the board did a letter from the executive office outlining the point of these administrative standards and what they all are. So again, we went over them in detail last meeting. So I gave you a couple different handouts on them, but I'll just kind of talk a little bit about the CPS ones. So those are numbers 4 and 5, so timely CPS assessments. And number 5 is CPS face-to-face visits, or timely CPS face-to-face visits. So you'll see October, November, in regards to number 4 of the assessments, we our stat that we got was 65.9% for timely CPS assessments. So that means that we fell in line with policy and completed them on time, which I believe is 90 days. Maybe I'm wrong. I don't have that in front of me, but and so then is it? Oh, no, it's 62. Thanks, Kayla. So in this last quarter, then, which was January, February, and March, in number 4 for timely CPS assessments, we did increase to 80.4%. So that was huge kudos to that team in increasing in that measurement. So we went from a severe failure to meet at that 65.9 to a meet standard. The other one was the face-to-face. So we were at an 86.7% on, and those face-to-faces are built based on those categories Kayla talked about, like the A, B, and C. So A is 24, B is the 3 days, and then C is the 14. So did we meet that time frame? So the October through December quarter, we were meet standard at 86.7, and then at the last one, we were at a 88.3. So again, we saw an increase in that. We continued to meet standard in those. So again, just context around the number of assessments they have or they're receiving. That's a lot of work that unit's doing. There's a lot of action that goes into it and then getting all that entered. So I'm really proud of their numbers and what they're doing. Obviously, I strive that I want to see 100 on all things, but I can't not give them credit for the work that they're doing. There is a dashboard that myself and the program manager over child welfare utilized with the management team to we can drill down all these measurements. So I can specifically drill down face-to-face timeliness, and then in there you can see each worker, and it will tell you the like literally by the minutes that they missed that face-to-face. So if I received this report at 1 p.m. and I had 24 hours and I didn't make my face-to-face the next day until 1:05 p.m., I technically missed my 24-hour time frame, but I get to see by how much. So that is just helpful because sometimes it's, we might have got to the school to see Johnny and he's in the middle of a really fun activity and he's having a good day and he had a pretty rough night because of what's been happening. So we may work with the school and say we're going to come back later. So it's just coordinating, which is why we work really hard to call ahead of time and say what's their schedule. So those are just examples of sometimes we can't locate if they're not school-age kids. We might not be able to locate them timely. Yeah, so I'm going to go over, when I'll kind of bounce back and forth when I get to the case management one, but that is my CPS update. Foster care in-home parent aid services. So currently I have 204 youth in foster care. 33 of those youth have the termination of parental rights in place. So those are kids that we are in the process of either permanency planning. They have an adoptive home, and we are working on the adoption home study, and we're waiting on a court hearing for permanency, or we are in recruitment actively for homes that are willing to adopt those kiddos, or we're in a search for them. In-home, we serve 35 families. That is just, that data is driven by the number of families. So each of those families could have more kids, though. So like when a case manager says I have 5 in-home cases, that could be 15 children or more. You just don't know. It just depends on the size of the family. And then parent aid services, I have 4 parent aides, and then they have a lead who also does some different courtesy case management when kiddos are here from other zones or out of state. But so that's a team of 5 of them then, and they have 88 families that they're serving. So again, they're going to be working with mom and dad separately on goals, depending on what they need. They're working on the kiddos with things. A lot of the work that team is doing is transports and visits. So they help us out tremendously with getting kids to appointments and then helping supervise visits. We are seeing a continued shift towards kinship and relative-based foster placements, with 73% of kinship providers offering respite care. So we're just seeing an increase in the number of kids that we're able to place into kinship or relative placements. Sometimes we still have custody of kids and they're placed with relatives because of custodial needs of the children, right? Like we might have a child who could be placed with a grandma, and then we lose parent engagement and the kid needs something that I don't have a custodian to make the decision on. So then we end up taking custody of those youth. That's just one example of how that can happen. We still are going to leave them placed with those relatives, but we just need somebody to have care and control over those kiddos. Okay, so then if you bounce back to my standards, those for case management is 1 through 3. Different things that we look at. So again, if you go to the quarter of October through December for, I'm going to pick on number 2, which is my face-to-face for visits for children in foster care. We were 94.7. In this last one, we were an 85.7. So January through March. Part of what we look at is it's not that those things didn't happen yet. The data just hasn't been entered into the system this is pulled from. I mean, obviously, I'm asking my team, are we not doing these things? But mostly what we're finding is because of the overwhelming amount of cases I have in case management right now and turnover in open positions, I have case managers who are averaging anywhere from 23 to 39 children on their caseload. The state standard is 12 to 15. So they're managing sometimes double what is preferred standard. So it's not that they're not happening, they probably just haven't been entered and this data was pulled. Another one to look at is the in-home one is the one below that. Again, that's the 2 visits a month. We were at a 65.3, and now we were at a 53.9. That too, we're talking about data entry, and that one we've worked with the department on. Though that one is hard because it's simply oftentimes just the way you enter the data. You have to code it correctly for how it's pulling. So working on that one. So those are kind of the 2 call outs. And again, we can drill it down by case manager so you can really address performance on those. Another one that I provided you guys was the more colorful one on the front with the charts. This, I just think it's helpful for you guys to see how we fall comparatively with other zones. So really that cover sheet is the one that has all the measures, and you can see the meet standards and kind of your key for what all the color coding is for. But when you look at Burleigh County, let's just say I'll pick on that CPS assessment one because we did improve in that one, number 4. So we were at the 65.9 for October through December, and you can just see where we fall compared to other zones. So obviously I'm going to pick on Cass, Ward, and Grand Forks because they're comparative to our size. Thank you. So when you look at that, it just kind of helps you understand like where we are compared to those zones. So yeah, this is just stuff I wanted you guys to get familiar with because part of HHS's initiative with these measurements and standards is that they will go to zone boards, and they expect that I review them or discuss them. So I just wanted you guys to get familiar with them. But I don't know if anybody had any questions on those. Okay, so then really in wrap up to everything else I have for child welfare is just continuing collaboration that we're doing. So we continue to meet monthly with ASK, Juvenile Court. When school's in session, we meet regularly with Bismarck Public Schools. We've been engaging with the UND Training Center and the Native American Training Institute, or we call it NATI, on improving services for the Native families that we serve and the children. So we do case reviews or case studies to talk about what we could have done different, how we can change our approach to be more trauma-informed approach versus kind of what we have been doing historically. We have worked with the Children's Advocacy Center to MDT training, which actually Kayla does. So that's for new members from law enforcement, prosecution, social services. We kind of do like an onboarding to talk about what happens in the life of a case. Many of our staff participated in a recent human trafficking training, and then we just continue to collaborate with Health and Human Services. They're going to be coming and doing some case reviews with us because we have had a great spike since the end of 2024 in the number of kids entering care, and they're often asking me why, and it's not, I always tell them I'm not out drumming up business, but there's obviously something going on that does happen. So whether that means, I kind of feel like we're the aftermath of an earthquake that happened. So whether that's because there's housing issues in our community or we need more services for family-based treatment services, we then end up being the catch of the family afterwards. So we're just trying to look at these cases and determine what led to that, what prevention could we do, and then what other services can be there for trying to get kids back home quickly. So, yeah.
And I just have one little more thing to add. Our transportation taxi service won't be around, I don't think, for much longer. So that will be another barrier for families as well. There won't be a cab service. I don't know if you guys seen that in the news, Chelsea. There was
Yeah, actually,
Medicaid fraud and all that. So I think that'll be a barrier for your family as well, because there won't be that non-emergent. Like, they won't be able to have their rides to the clinic or anything like that. So I don't know if you guys can help them with that.
yeah,
Driving them.
yeah, we do a lot for our families with transports, pretty much taking them wherever they need to go, kiddos to school. It's a lot on our foster parents too, so we actually still do a lot of transports when kiddos are in foster homes, because they might get placed out of their school of origin community, but we want to keep the kid in the same school. So if they usually go to school in Lincoln and their foster home's in Mandan, we understand that's a burden on the foster home, so we try to do as much as we can to help with that. But to your point, Trevor, yeah, I participated in the when you were on the panel for the Human Relations Committee, and I try to stay on top of transportation in the community because that is a big impact to my families. Yeah. That's really all I had for program updates. I'll try to cruise through the rest of the agenda. Thank you guys for being patient. I knew this would be a heavier meeting because of other things we had, but the next on the agenda was the financial report. So I'll punt that over to Tian to kind of give an update.
All right, so in your packets, we just gave you guys basically a handout that shows comparatively what our current 2025 budget looks like compared to our recalculated 2025 budget. In the time frame of May and June every year, we work with our state fiscal partners to review and revise the existing annual budget for our zone. So that's what that is. And then at the same time, we take a look at next year's projection. So that is there for you as well. And so each of those have now been approved by our state fiscal partners. So that's just information there for you to review. Pretty much from 2025's revised budget to 2026, there's really no changes of note for anything really outstanding, other than there's some programmatic decreases, and that's really a representation of some services that the State Department will be taking care of directly on their end. So we're not going to see some of those payments run through our zone offices anymore. The state will be handling those through kind of collective contracts and things like that on their end. So.
Another thing that you might see on there is we had we were financed for another county vehicle. So right now we have really one county car that's operable between all my staff. Otherwise we rely on like rentals for when they're doing out of town or longer travel. So that is in the budget for the rest of 2025 that I need to procure another vehicle. So you'll see that, and then it's out of the budget for 2026. Any questions on that? Next on the agenda is public comment. There is no public to comment, so we'll cruise in just to the end of the agenda. I don't have any other business. Really, it's just everything we kind of went over today. Those are our priorities, things we're working on. So I just, again, appreciate this board's time, your guys' support, advocacy in your own way that you're connected to this agency. So I appreciate that. So if there's nothing else, I'll adjourn the meeting. Thank you.
I think it was a good meeting.
Thank you.